We've seen instances where the state legislature have had some interaction or affinity with the commission. How will you describe the harmony in making sure that there are plausible rules and laws to foster the smooth operation of the commission?
Yeah, we do our best to be in touch with them, pay advocacy visits to them, and we are privileged and blessed to have a robust House of Assembly Health Committee on Health, head by by Honorable Ferguson Omo, who, apart from being a personal friend, was the immediate past majority leader and is seasoned with other members who are in that committee. We relate with them, we interface with them, we tell them our problems, our challenges, and they also carry out their oversight functions, asking questions. Just a few weeks ago, they were here, and they were full of plaudits, and quite impressed with what they met on ground.
All right, sir. That said, sir, the mandate given and the initiative so created, how do you put activity to them in ensuring that you describe the access to health for all the Earthans? How will you describe the roadmap so far?
Well, when we came on board September the 25th of last year, we hit the ground running. I came up, well, you need to understand, it's a 10-man board. The DG and I, the chairman, we are nominated by His Excellency the Governor. We are screened and confirmed by the House of Assembly according to our law. Thereafter, we are sworn in by His Excellency. Like I said, we hit the ground running. I came up with my 10-point agenda. But luckily, not long after that, our ex-official members were equally nominated and were inaugurated to make sure that the commission caters for the wide range of Deltans. Various interest groups were accommodated in the governing board, i.e. NECA, Nigerian Employers Consultative Association, that takes care of corporate bodies. You know what I mean? Then, of course, the Ministry of Economic Planning, the State Ministry of Health, the labor unions, TUC for the senior staff, and the NLC for others. Then, of course, we are also synergizing and leveraging with the experiences and track record of the NHIA, that's the central government, the federal government health insurance agency. With that, we got our 10-man board in place to give life to the plans of the mandate that we were given. Number one, we need to increase coverage. That is to say, the enrollees, we must increase it. We set a very big target for ourselves. 1 million enrollees within the first 1 year. That's a big one, but we're working on it. But it would be nice to put on record that we're the first and the leading health insurance body nationwide. Our enrollee figure is so high. We hit close to 2 million since inception. Now, we have different health plans. You have the equity, which is basically to take care of the vulnerable. We have the formal sector, which is civil servants and public servants generally. But we want to hit to the grassroots. That's the informal sector. Artisans, market women, traders, and the likes. Then, of course, students. You know, the youth make up the larger portion of our demography. So at the board here, we adopted certain initiatives. The indigent enrollee adoption scheme, whereby, like the Holy Book says, love your neighbor as yourself. Those who are well-to-do are encouraged through our advocacy to adopt indigent persons in their society, and it's working out very well. We've gone to local areas like Onitsha Olona, Ibuzo, the UPU, Rural Progressive Union. People are adopting indigents, even from the diaspora. As a result of our advocacy, people are adopting. That's just one aspect of it. Then, of course, like I mentioned earlier, we have a large pool of artisans, vulcanizers, Okada riders, keke riders, transporters, trailer drivers, and the likes, food vendors. Our premium is low. Actuarial studies show that our premium should be about 12,000 naira per annum. But His Excellency, in his wisdom and compassion, insisted that we make it 7,000. So, for 7,000 naira per enrollee, that's per person, you can enjoy quality, affordable, and humane healthcare in Delta State. Now, we have almost concluded, subject to approval from His Excellency, to discuss with certain banks who will give us a financial line, not a loan. Not a loan, a financial line is under wraps, but it will help in the artisan inducement scheme. You notice we deliberately use the word inducement. Monies are made available. The artisan comes in rather than go to the chemist or visit the Agbo woman or engage in self-help. He goes to any of our 60-something government hospitals, close to 200 PACs, and accredited private hospitals across the state is available. Then the last but not the least, we have this tertiary institution social health insurance program. I'm sure the airwaves have been carrying it. Went to Denis Osadebe University, we're enrolling the students. Because a healthy mind is the mind that can do well in school. We've been to UNIDEL, University of Delta at Abo. Discussions are on with all the other tertiary institutions like Delsu Abraka, the School of Health Technology, colleges of nursing sciences, and the likes. So that is in the area of coverage. But the question to ask, you get all this humongous figure, how do you take care of them? His Excellency has been wonderful. There is regular phase rehabilitation and maintenance of hospitals. His Excellency the Governor has given us his full support all the way. Like we say in our local parable, the person when Papa send message, now with gumption, the kick door open. He's behind us all the way, including Her Excellency, who I'm sure you know also has this program, You Matter. There is a health part of it. But coming back to the second thing I was mentioning, that if you have this humongous population of enrollees, what do we do? It's very important. It's not an accident that after being chairman of HMB for so many years and being a medical doctor for so many years post-graduation, that Providence and maybe some planning up there brought me here to be the chairman. And we have a DG who is very well versed in insurance matters. So with us and the other 8 members, we insisted that our hospitals, as the Excellency is rehabilitating, rekitting and re-equipping them, the human touch must come in. So we have agents in all these hospitals who will assist our enrollees, put them through. Don't forget, some of these enrollees are not lettered. They have to, and beyond not being lettered, when a man or a woman is ill, they are helpless. Any help they can get is very important. They are there assisting them in most of our hospitals. We have more than 300 agents out there in the field with their handheld, working. And I call that, if you look out there, enrollee satisfaction. The enrollee, as the client, that's the patient, must be satisfied. Thirdly, we have a scheme we call access to finance. This scheme has been lauded. It's the first in the whole country. It's been celebrated by the WHO and other developmental partners. What is the program all about? The Delta State Contributory Health Commission, in partnership with the Bank of Industry, right here, we have a guaranteed fund placed there, whereby persons with proven track record in managing successful health institutions, it is advertised, they apply, they are screened, not by us, but by reputable organizations like the BOI, Bank of Industry. When they go pass through that test, we now bring them in, discuss with them, then there's a process through which they are allotted health facilities. For the access to finance, what makes it so wonderful is that it is meant for the riverine areas and the hard to reach rural areas. They are part of our state. Don't forget, we said, leaving no one behind. Everybody must enjoy the dividends of democracy. I tell you, some of the riverine areas, Polopubo, 3.5 hours on the high seas, Oprosa, Waterside, Ogbingbiri, Obodobodo. These are some of those areas. They are all bearing. They contribute to our GDP as a nation. Therefore, they deserve to benefit from this, His Excellency's more agenda in this area of health. Beyond that, you come to the, will I say, the land-based areas. They are hard to reach. Igbogiri, Ashama, Amai, and the rest of it. We are out there trying to make sure that Deltans who are there are also, they can have access to affordable health coverage. You can imagine at a time when a package of Augmentin is hitting almost 40,000 naira. And that may just be one of the drugs for treatment. Our premium is 7,000. So there must be something that is being done right for the patients to benefit. It's their right to good health. Having spoken about access to finance, we must look at the issue. When you hit the street, there was the common man, common Deltan, walking on the street. Are they aware of this program? How many of them know that they can benefit from this program? So we have embarked on a sustained advocacy drive, road shows, print, electronic media. We are rolling out to let people know that the government of Delta is very serious, is a leader in the health insurance scheme nationwide. Beyond all of this, there are challenges. Clearly, there are challenges. Our law, because you mentioned the law earlier on, our law mandates us as a commission to register all Deltans. That is one of the things that are in the pipeline, that all Deltans will be registered. Without proper statistics, it's like winking in the dark. Statistics, poor statistics has been a bane in the Nigerian system. You must have data to plan. How many pregnant women? What is their projection? How many children under 5? What are the disease patterns? And all of that. But above it all, how many hospitals do we have at the secondary level? How many do we have at the primary level? How many do we have at the tertiary level? This is now, we are the funders. We fund health. Delta has DELSUT and FMC. They are teaching hospital level. This commission is in partnership with them. And recently, the Asaba Specialist Hospital here in the Capital Territory has gone through NUC, NMCD accreditation to also be a teaching hospital. So you see, with all of this happening fortuitously under the regime of Right Honorable Francis Orowedo Oborowori, health for all Deltans will be not just a slogan, but a reality. Our commission, to be able to do most of these things, we must be fully digitalized. The other day when we were doing a tour of our facilities with our honorable members who were members of the health committee of the Delta State House Assembly, we will say in 3 minutes, max 5 minutes, somebody can be registered. And with that card, that person can access health statewide. Our digital system is work in progress. That's our IT system, is work in progress, but I can tell you we're not doing too badly.
Thank you so much, sir, for this time given. We look forward to having more of this engagement as time permits. Thank you so much, sir, for your time.
Thank you.